Welcome in to everyone joining me on this New Zealand Institute of Environmental Health hosted video to discuss the World Environmental Health Day 2022. And the theme for this year's World Environmental Health Day is strengthening environmental health systems for implementation of the Sustainable Development Goals. We're trying something new here in New Zealand in terms of getting some like-minded people and from the environmental health profession from a few corners of the globe together, just to have a wee chat around some of the implications of what World Environmental Health Day this year is all about with the Sustainable Development Goals. So just going around and introducing people, we'll start with our nearest and dearest neighbours in Australia. We've got Kelly Williams, who is joining us on behalf of Environmental Health Australia. I think it's good evening for you, Kelly.
That's right, 9 p.m. here.
Perfect, fantastic. We'll go, I think I'm going in the right order here, but forgive me if I'm wrong. We'll go over to Malaysia now, to our Malaysian president. Good evening to Megat, how are you?
Good evening, I'm good. 7 p.m. from Malaysia.
Fantastic. And then we'll go up to Dr. D, Mr. David Dijak, who's the National Environmental Health Association of America, also known as NEHA, Executive Director. Good morning, Dave.
Yeah, good morning. It is 7 a.m. Megat, we are on the opposite side of the world, 12 hours away from you. It's good to see everyone.
Fantastic. And last but certainly not least, joining us from the UK is the Chartered Institute of Environmental Health President, Julie Barrett. It's just in the afternoon there for the UK.
Hello, yes it is. It's just noon here.
Fantastic. And in case anyone was wondering watching this, what time are we all joining you from New Zealand? We were doing this at 11 o'clock at night. I think I took one for the team there, try not to make it too rough on my counterparts around the world. But look, it doesn't matter what time it is. Some say it's 5 o'clock somewhere, but that's a different story. But we're all here to talk about environmental health matters. So again, thanks everyone for joining me. So how this is going to work for our viewers is come up with a few different questions just based around the theme of Environmental Health Day this year. And essentially, this is going to work a little bit like a panel discussion in terms of everyone just giving their thoughts from their part of the world. And then we'll see where that goes in terms of any healthy discussions. Could lead to a debate, we'll see. But it's really just to give a bit of insight into the different things that are happening in our profession across the globe. So with regards to the slight elephant in the room coming off the last couple of years of a global pandemic, it would be interesting to know from everyone where you see environmental health currently being placed within your country. Obviously coming out of, I think it's fair to say for the whole world, the global pandemic, we're certainly at the tail end of it. So we might start actually with you, Julie, if that's okay. How are things shaping up in the UK for you at the moment?
Regretfully, I have to say, not fantastically. We've had a change of Prime Minister, a lurch to the right, with an expressed desire on the part of government for deregulation, looking very much at deregulating environmental restrictions. There's been an awful lot of noise about industry being allowed to defetter itself. So we've seen a lot of issues about pollution of watercourses, sewage being allowed into rivers and onto beaches. The moratorium on fracking is currently under review. Today, the government has announced that it's looking at redefining what actually constitutes an earthquake, which would allow fracking to carry on with less sensitive parameters to stop it. The push for business to be allowed to move on is overriding environmental concerns, and it's enormously concerning. And we're making a lot of noise, but frankly, a government with the majority that this one currently has is not really going to listen. It's really quite a depressing place to be.
Wow. Dave, what's things like in America at the moment?
Similar to the conditions in the UK, but I would qualify our state of environmental health as being unsettled. We are still recalibrating after COVID. The country's large. There's 350 million people almost across many time zones. And what we're seeing in places, Julie, is an active campaign to decouple environmental health from public health in a very assertive way. They would like, at the local level, the politicians would like to put environmental health in what we call weights and measures and remove it entirely from the health conversation, which is deeply disturbing. There are local attacks on credentialing, meaning at the individual state level, there is an emphasis on perhaps having less talent and less educated talent involved in the environmental health profession, and that's disturbing. And then the initiatives around freedom to farm, cottage foods is also taking root. Individuals want the freedom to poison themselves. And again, this is all playing out at the local level, but when it happens in influential places, others take notice and of course try to copy that. I don't want to sound depressing, because throughout the country, we still have many very strong programs and energetic and enthusiastic professionals, but we certainly have our challenges. Over.
Thanks, Dave. Magat, what's the state of the nation in Malaysia in your surrounding area at the moment?
Thank you. Environmental health has always a strong foothold within the Malaysian healthcare system, with roles of the environmental health practitioners linking to issues such as water quality, food safety, vector control, infectious disease, and other aspects of community and public health. The environmental health practitioners have kept busy on environmental matters. However, the pandemic has seen an increase in both of the responsibilities of the environmental health practitioners, and recognitions of the roles of by the public. The pandemic has relegated the environmental health practitioners as one of the core frontliner for COVID-19 prevention, particularly on matters of lockdown, quarantine, and contact tracing. Even now, 2 years since the pandemic started, environmental health still taking a center stage in critical health issues in Malaysia, with COVID-19 taking a leading spot. However, I believe the pandemic is not the only reason why environmental health is gaining more public recognitions today. And one of the reason in the increasing awareness of climate change and the impact it will have on global health and well-being. On that note, the environmental health role within the issue of climate change is still hazy and will require more effort to pinpoint. In short, the global pandemic has highlighted the importance of environmental health in the healthcare system, but more effort needs to be done to ensure that environmental health matters and being critically considered within the government, and not just to matter pertaining the pandemic and other infectious disease. Over to you.
Great, thanks, Magat. Kelly, we'll throw to you for an Australian perspective.
Thanks. That's really interesting hearing the others. So contrary to Julie's situation over there, we recently had an election and had a very big change where our previous government, as you're probably all well aware, had not really embraced Paris Climate Agreement and made firm commitments there. The new government very much took on public opinion that we want action on climate change. So there's a lot of change happening now around that. And so that's one element. In terms of COVID, it was around the end of last year that we had reached some goals in terms of vaccination levels across most parts of the country. Of course, there's some areas where vaccination is lower, but in terms of our restrictions, quarantine, border closures, travel, all of those things. Once we hit a certain level of vaccination, all of those restrictions and impositions, I suppose, on freedom of the public and also business started to lighten, and they've decreased and decreased and decreased to the point where now you could say everything's free and back to normal as it was before the pandemic. In terms of the environmental health profession, one really notable thing was that I would say before COVID, there was a great awareness evolving in Australia around reducing single-use plastics and reducing waste and the impact that waste has on the environment. And that more or less just had to get shelved during the pandemic due to the vast amount of single-use material that everyone from healthcare and hospitality businesses and, I mean, you name it, everything was single-use. So I think now that we're coming out of the tighter part of the pandemic, that shift will go back to reducing waste. In terms of the role of EHOs, environmental health officers, during the pandemic, it very much shifted. Our business as usual work almost, I would say, halted, and we had to pivot very quickly. And there was a big difference between state and local government environmental health officers, the duties that they did. The state government environmental health officers were largely responsible, as Magat was saying, for assisting the health department with quarantine notices, contact tracing, that public health side of COVID. The local government sector environmental health officers were very responsive in, I suppose, ensuring that all the restrictions that were put in place around social distancing and business restrictions were being upheld. And then there was also a really big difference between city EHOs and regional EHOs, just by the nature of the kind of work that we do. So in the regional areas where they have a lot of agricultural workers who stay in tourist accommodation and boarding houses and caravan parks and that sort of thing, they had a huge workload on their hands trying to help everybody adhere to social distancing when they're by their very nature in quite crowded quarters. Whereas in the city, we were dealing with business closures, hospitality businesses going broke, very, very big changes to food production and food delivery and that sort of thing. So yeah, I think there were some really big differences between state and local and regional and city. But what I would say now is that everyone's pretty much back to their normal environmental health work. With a very well-trained workforce, should there be another pandemic, I think it would be very quick and easy for everybody to pivot back to the pandemic way of life and focusing on those duties at that time. Yeah.
Wow. Thanks, Kelly. I think in New Zealand here, our position here in environmental health through the pandemic was probably one of the most unique ones, looking at environmental health professionals around the world. Because in short, we weren't really involved in the pandemic at all, and to this day still haven't really been overly involved. When it first hit here back in early 2020, some of our environmental health officers around the country, depending where you were, got pulled into the response in varying roles, such as in airports helping with promotional materials for incoming passengers, remembering this is more so when the pandemic first hit. Others, myself included, got pulled onto contact tracing at times to help out our public health units. But there is a bit of a division in New Zealand between environmental health and public health. And I think that gap is only slowly but surely over the years continuing to grow apart, unfortunately. So the public health branch have more of the communicable diseases and amongst other things, they're really leading the response to COVID in terms of under the health banner. And environmental health is still just sitting off to the side and almost more of just a regulatory capacity. So I love your word you used there, Kelly, about pivoting. The main pivot for us really in general was that we were obviously restricted in what we can do with lockdowns, etc., as everyone was being based at home. But essentially it was finding a way to put things on hold in a different way to keep doing our day-to-day work. The majority of us were in that position. The minority of our profession were involved in the response actively on the front line. But in even the second year of the response coming into 2021 and coming into 2022, the role of environmental health officers in the pandemic has been less and less. So that's a really interesting position from the COVID response point of view, and I think it's different to most other counterparts around the world. As a profession
and
here,
yeah, I might just say, actually, that is when you said public health and environmental health are quite separate, that is actually similar to here. When I said
Right.
state government and local government are quite different. So our state government EHOs do exactly what you just described in the public health side of it. And the local government do the more environmental regulatory side. So yeah, it is actually quite similar. I used the word state and local, but it's very similar to what you just described.
Yeah, sounds like it, absolutely. I think the biggest thing for us is that we're still the silent profession here. We really are. So, and we'll touch on this a wee bit later with some other questions that I'm going to fire at you all, but you know, even at a local level, even within our own organisation sometimes, and then you start growing even further beyond into state and our national government and beyond, and even internationally. We're still trying to find our voice and create more of a voice for ourselves and then actually use it on a more frequent basis. On behalf of our institute, we are in a growing position and a strong position as professionals and membership that we have. We're in the best position we've been in over 100 years, and our institute has been going for over 100 years, which is a phenomenal feat. But like as Dave mentioned, we do see more and more people coming into our profession who are not environmental health professionals. So you are now seeing a move towards hiring people to do the role of an EHO or part of the role who are not in any way, shape or form qualified to do so. And the main reason they're getting away with this is unfortunately just the framework isn't there to stop it from a national government level. And also because it's often cheaper to employ people as what they would call a technical officer to basically go out and do inspections, complaints, whatever it might be, all manners of public health nuisances, whatever, and that you really only have to bring in the heavy hitters of EHOs as and when required, when some of our ageing legislation specifically says you need an EHO for it. So that's an ongoing battle, and we feel that the profession is slowly but surely under threat, which I think is something that you touched upon, Dave. I guess in terms of the World Environmental Health Day, having a focus on the Sustainable Development Goals, if we can shift track a wee bit, because I think we're going to circle back a little bit to what we've all mentioned around the screen at the moment and the impacts of environmental health, the pandemic, and obviously what our future direction might look like. But jumping sideways to the Sustainable Development Goals for a moment, when we look at the different goals, is there any particular goals that stand out for you all as we go around? And could you maybe give an example of just one initiative that might come to mind where those goals, I guess, are being actively actioned within your country, or at least there's some sort of an initiative that's trying to address one of those goals? So Magat, we might start with you in Malaysia. Is there any of the goals there that stand out to you? Any initiatives that come to mind in your neck of the woods?
Thank you, Tanya. Malaysia has always been supportive party to the United Nations Sustainable Development Goals, with various activities being conducted to better support all 17 goals. One recent example is the Malaysian Youth SDG Summit conducted in June 22 with the aim of promoting a localized effort to promote SDGs among the community and the youth. Within this summit, about 13 young participants between the age of 13 and 30 were invited to discuss and present their activities pertaining to promoting the SDGs. Not only that, the Ministry of Education, together with the university, has previously launched School SDG, translate as the SDG School, as part of the effort to promote SDG awareness among young children. Earlier this year, on January 2022, the My SDG Foundation was formally launched in collaboration with the United Nations in Malaysia, with seed funding from the government of Malaysia to support the aim of the Sustainable Development Goals. This is another example of effort being made towards promoting SDGs. Over to you, Tanya.
Thanks, Bhagat. Kelly, we might throw to you. Is there a particular goal or an initiative that stands out for you? I'm sure there's many, as we can all list probably multiple. Is there one in particular that stands out?
In terms of, I wouldn't say that across the board in Australia, SDGs are being formally addressed or formally reported on. That's certainly not mainstream yet. But I would say that there are lots of things that we do that actually, by their very nature, are actually in line with reaching the goals and the indicators. It's just we're not reporting on them. So, for example, there's a national Australian drinking water guideline. Now, it's non-mandatory standards, but it is scientific, evidence-based, and it's everything from water. The guidelines are for use by all agencies across the water sector, including drinking water suppliers, regulators and health authorities. There's also tobacco legislation, which involves a lot of things like plain packaging laws, laws on smoking in public places, tobacco advertising bans, all the sorts of things that obviously support reducing tobacco smoking. So that obviously aligns with Target 3, 3A and 3.5. There's also a Modern Slavery Act that's also federal legislation. So I would say that aligns with SDG 8 for decent work and economic growth, SDG 10 for reduced inequalities, and SDG 16 for justice, peace and strong institutions. So that Modern Slavery Act only came in 2018, and it requires all entities with a consolidated revenue of over $100 million to report annually on the risk of modern slavery in their operations and supply chains and take actions to address those risks. So we are doing some things that really do align with what we need to do. We're just not we're not capturing it at all levels, like private sector, public sector, local, state and national, and we're not reporting on it effectively. If I might just say one other thing, there was a government report and a Commonwealth of Australia report done in 2019 on how we were tracking with the SDGs in our country. And I'd just like to read out the recommendations that came out of that report, because I think they're all great. I just wish we were doing them. So they are to establish an SDG secretariat to provide ongoing support and a national implementation plan. The government to provide indicator-based assessment to Parliament every 2 years to track a performance, to integrate the SDGs on all internal and external government websites, to work with state and territory governments to add SDGs to the Council of Australian Governments agendas for regular discussion, to include local and state data in national reporting. So that's not currently happening. Any reporting that is happening for Australia is at the federal level, which is really just overarching. It's not including all the nitty-gritty of what's going on down on the ground. To support civil society engagement with the SDGs and to partner with tertiary and private sector stakeholders to develop and disseminate Australian guidance on consistent and transparent reporting and data integrity. So, like I was saying, I think we're certainly doing things that like we're still doing gas extraction and coal mining and all those things that cause pollution. But, there's a lot of great things that we are doing in Australia that we could be capturing, and that I think it's that lack of a consistent sort of either globally or nationally adopted framework and I suppose recording and reporting system, the way you have it kind of streamlined in other industries like accounting and that sort of thing. We don't really have that for qualitative reporting in Australia. So so I think it's a new way of doing business to report And it's going to be a huge mapping exercise when we get down to implementing recording and reporting. But that doesn't mean we have to start everything from scratch. You know, we're doing things. We just need to capture it properly.
Yeah.
Mm.
And I think that's probably a universal thing. There's quite a few nods of the head going on around the screen at the moment. Julie, would you agree with that in terms of, yeah, there's some good stuff happening, but implementation is maybe where things are falling down?
There's good stuff happening, sure. I'm not sure it's necessarily happening because of the SDGs, but it's happening. And a lot of it is being countered by other things. You know, you've got devolved governments in the UK taking action separately from each other. For example, only this week, we've seen the government in Wales talking about a ban on single-use plastics in Wales, which will go and above and beyond, catch us up to where England is, really. So we're moving at different speeds, but my greater concern is that the stuff that is being done is being done on a small scale. There is bigger stuff being done, which is having a far greater detrimental impact. You know, having worked for years to improve water quality, suddenly, in the space of no time at all, water quality has taken a giant leap backwards. And it's to do with cost of living, it's to do with cost of energy. There's all sorts of reasons why it's happening. It's to do in large part with Brexit and a desire to deregulate. We're in a difficult position at the moment, and a lot of wins have quickly been overturned. And it's going to take a lot to get us back to them. I don't think in the UK that the SDGs are actually the driver that they might be. They don't seem to drive action. Sometimes in consequence of stuff that is done, we can say that we have contributed to delivering an SDG, but I wouldn't have said that it was the driver. It's the fortunate consequence. So, for example, in some of the bigger cities, we're seeing congestion zones and we're seeing CO2 bans on vehicles that can go in and all the rest of it, which is all good and all contributes to improving air quality and improving quality of life in cities and making cities more sustainable. But it's not done for SDG reasons. It's being done primarily for health and livability reasons. The SDGs don't drive us in the way that they should, which really is an enormous shame, considering we hosted COP22 this year. You would think that as a driver, they would be much more prominent for us. But right now, I think with the position in Ukraine, the cost of living and Brexit, the government has taken its eye right off sustainable development. And it's going to take organisations like us and really other interested individuals, people with a big voice, to push it and to get it back up the agenda. But it's going to be an awful fight. You know, let's have no doubt about that. It really is going to have to battle for its place on the agenda.
Yeah, I think that definitely mirrors, you know, the voice, having a voice for environmental health across the board, and not just environmental health, but anything that relates broadly, loosely to it as well. Dave, similar thoughts from your neck of the woods, or a different story entirely?
Well, we have some good news to report, but first I'd like to close out, Tanya, be a little bit radical, that first question. And I just want to say for the whole world to hear, public health is part of environmental health and not the other way around. And I'm trying to figure out how to convey. I say that in front of groups of physicians, and I sometimes get booed, but it's simply true. If you look at the data and the evidence, the foundations of public health are in environmental health. The United States does not, in my experience, even talk about the Sustainable Development Goals outside of our international activities. In all the years I've been in practice, I've never heard them referenced even once. Having said that, Sustainable Development Goal 10, health equity and climate change, I'm delighted to report, are receiving a profound amount of attention, not as SDGs, but as action areas in the US. In August, Congress passed the Inflation Reduction Act. The bill produces or provides $360 billion to address climate change. This is the single biggest investment in climate change in the history of the country. The goal is to reduce greenhouse gas emissions 40% below 2005 levels. And so this government is providing the leadership. Leadership matters, and we're getting that. The bill also aims to tackle environmental justice issues. If we had more time, I'd describe those, but SDG 10 and 13 are being addressed by the United States. The role of EHOs in that process is still a little bit murky, and hopefully the next time we talk, we'll have greater clarity around that. But I'm delighted that the US government has stepped up to the plate, is now back with the Paris Agreement, and we're looking forward to providing leadership around climate issues in the US and abroad. Over.
Cool, thanks, Dave. I guess in a New Zealand context here, when we look at it more nationally, there's definitely a drive towards climate change. And you see that around different parts of the country, and local initiatives such as increased cycleways, more green spaces, trying to make public transport cheaper to promote the use of less cars. Local government authorities, so local councils, etc. There's a movement that their fleets of cars and vehicles should be electric within the coming years. So there's things there that the government are filtering down through local government channels, such as council workers, local territorial authorities over the few years. That's where they want to lead the charge. I guess one of the other things in terms of responsible production and consumption is one of the goals. Even at the 1st of October here in New Zealand, there's a range of different plastics and products that are now going to be banned. So that's something that, leading off on what you said earlier, Kelly, with you know, when COVID hit, we were just starting to make good progress on less single-use plastics. And then again, like you, it all went on hiatus because we had a global pandemic to deal with. And then we went the other way. Everyone wanted everything sterile, clean and single-use and packaged again, from fear of the unknown. We didn't know what this COVID beast was, but we seem to be slowly getting back on track now. So some of the things coming in on the 1st of October in New Zealand is the PVC food trays and containers will be stopped. The polystyrene takeaway food and drink packaging, which is also the expanded polystyrene, so the old polystyrene thermal cups for your cups of coffee. Some of the plastics with the pro-degradant additives and different biodegradable plastics. There's a shift on the kinds of plastic bags you can use. The plastic drink stirrers for takeaway drinks, and the plastic stemmed cotton tip buds. So they're starting small. There's a few things there. You know, even your loaf of bread at the supermarket, it's still in a plastic bag, but you can't have a plastic bread tag around it now. It's got to be a cardboard one. They're little things. They don't necessarily all relate to environmental health per se. We will see some of these things fall into our food traders and food safety, but there's small steps that I guess are being led on a national level. So that's promising. I think if everyone has been critical, you can always do more, or you could always, as Julie said, push on a larger scale, that there's a lot of maybe little things happening, but what are the big things we're trying to achieve? So I think we're probably all in the same boat, relatively speaking, that we could be, depends what side of the argument you want to be on. There's some good stuff happening. We want to be positive, but we could also be a little bit critical that we can always do more. I think it's probably how I'd sum it up here in New Zealand as well. With regards to, I might just morph in the next couple of questions together into one a little bit. Wanted to focus a wee bit based on the sustainable development goals about some of the resources, and we've touched upon this already with even just water and things as well. One of the fascinating things here, I'll be interested to hear other people's thoughts with lockdowns through COVID. Everyone said a few things when we all couldn't go far from home, how quiet it was and how clean the air was. Because you didn't have cars on the road. It was insane. You could go for a walk, and even though you're dodging people, you know, and giving everyone a wide berth. I mean, dogs have never been walked so much in their lives, but it was quiet, and just the emissions and the greenhouse gases and the climate change, and obviously everyone took a step back and looked at that work-life balance and things as well. So, you know, there was a few little happy offshoots that kind of came out of COVID in a weird way that made us kind of sit up and go, oh, if we stopped doing a few of these things, look what can happen. So I guess my question to the group is, in terms of our resources, how can we look after them? How can we, I guess, promote the preservation of them? And what would be, I guess, something or do one thing as kind of a challenge catchphrase we use here in New Zealand. If we all just did one little thing collectively, we'll achieve great things. What can we as environmental health officers do to help protect and promote the use of resources in a smarter way? If I lead off from a New Zealand example, I know here with our institute personally, we're trying to be a little bit more visual as a professional institute through even our schools and our tertiary providers as well, which is a slow journey, but we are definitely gaining momentum as we can. And we're trying to support external agencies and causes, whether it's waste reduction or waste-free warriors, Keep New Zealand Beautiful Week. We've got campaigns there. We're trying to reach out to our members and things as well. The whole goal here as environmental health officers, individually and collectively, is that we want to lead by example. So there's small things we can do. If you all go to a group meeting and you all want to go do a coffee run and no one has brought a keep cup, you need to hold your counterparts to account and say that is not good enough. So you can't turn around and be an educated voice saying we need to use less waste, we need to reduce and reuse and all of these things, and then you go straight to the capital end of the scale and just capitalism and go and buy all these single-use products again yourselves. No one's perfect, but this is the little wee small things I think we could all do, because they will have a big impact if we lead by example. So I'd be keen to hear other people's thoughts on this. Julie, might start with you this time. How can we look after some of these resources? What as EHOs can we do?
I think talking about what we as CIEH can do, first of all, we have for a long time been champions of sustainability. Our headquarters at Chadwick Court is the most sustainable venue in London and has got awards for being so. It's got reused materials, things like cushions made out of seat belts. We only use drinking water that comes from the taps, all this sort of stuff. It's all very sustainable. It's very good. Our magazine is sent out in compostable wrappers so that people can use it as a bin liner or just throw it away. All of our meetings, or the majority of our meetings now, are online. Instead of having conferences where people converge on hotels in cities using transport and all the rest of it, most of the stuff is done on Zoom or on Teams. And we found that's actually better. We have much more contact with members because everyone can get to a meeting if you sit in your living room. And that's been a real switch and people have embraced it. But that's a very small thing. You know, we're 8,000 people. On a wider and a more professional scale, I think the one thing that EHOs can do is start trying to influence planning policy. Start talking to planners, developing plans about how we should be managing resources. And building sustainability in. Now, our planning colleagues know about sustainability, but we know about health impact assessment, and we should be bringing that into planning policy and saying, hang on, before we plan for a road, what are the alternatives? Is there a cycle path? Is there a walking route? Are there facilities that people can get to so they can live their lives sustainably without trying? If we can make sustainability the default option, by influencing planners and by making sure that anything is done is as sustainable as it can be, then I think that's our role. I'm all for small changes, but small changes are small. We need big changes that allow people to be sustainable without even trying. And if that is planning for electric charging points or LED streetlights or walking as a default position of using cars, then that's how we make the big, easy change. And I think that's the important thing. It has to be an easy change because people don't like doing difficult things. The martyrs will always do it, but it's the mainstream that we have to make, or we have to facilitate rather than do these things.
Yeah, I love that idea. And you did right, getting more involved with planning. You're 100% on the money. And also your other comment there about making it easy. And I can even speak on a local level here, the city where I live at the moment, it's, you know, a generic rubbish collection. They're looking at moving to the 3 different coloured bins, and there's different places around New Zealand that already do this. But if you know that one is for organic, you know, food waste or, you know, things that are compostable, if you know that there's the glass recycling and then there might be a green waste, people will actually use them. They're colour coded, it's very easy to use. And it's just a shift. I mean, we all managed to cope when we took plastic bags out of supermarkets here a few years ago. Now you've got to take your own bag to the supermarket. We all complained about it at the time, or a lot of people did, but now it's just what you do. So it's a culture shift, it's a mindset shift. And you're right, there's no reason why it can't be on a larger scale. Small things have their place, I don't deny that, but you're right, we can definitely think bigger. Dave, what are your thoughts on this?
believe that environmental health is profoundly local, and we should show up and speak up at the local level to impact decisions, as Julie has pointed out, around policy and practice. When you think about the single profession within public health that has access to the private sector, to schools and to hospitals, who is that? Who was the group that was making decisions about restaurants and trains and planes and places of worship and beaches during COVID? Which profession was that? And which profession is the most visible in public health? Think about restaurant grading. And we just published a paper on that, which shows restaurant grading works in reducing foodborne illness. Which profession is that? That's the environmental health profession. And what I know, Tanya, is that environmental health professionals love to learn from each other, kind of like your vision of this webinar. We need to, as a profession, show up, speak up, and then share our lessons learned with our counterparts, because people trust individuals just like them. And I think this kind of thing, a global platform where we exchange best practices or emerging kinds of promising practices, I think is really important. I'll close by saying it's critical that each of us addresses dis and misinformation at the local level, because those rumors begin at the local level and then just take off. In the United States today, someone had been posting on using NyQuil to cook chicken, and it's incredible, the buffoonery, and it's up to us at the local level to address those kinds of things, to make sure that our constituents know what they need to know when they need to know it to make informed decisions.
Never put it past someone to come up with a new way to cook chicken, that's for sure. But you did
That's
right.
incredible.
It isn't that incredible. How many of us, well, maybe before we retire, are definitely thinking about a coffee table book of all the trials, tribulations, and the bizarre things we've come across in environmental health? We'll save that for another webinar. Kelly, what are your thoughts around preserving some of our resources, and what environmental health officers might be able to do to contribute towards that?
I think that we are already subject matter experts in this. However, I appreciate what Dave said about the opportunity at the local level to raise awareness, and as Julie said, the small changes. I agree with all of those things, but I hate to say it, I feel as though we need, in the case of the SDGs, we need it embedded into the legislation. It's like we all knew there was a global waste problem. Okay, we've known that for quite some time. We've seen it washing up on beaches and getting tangled around turtles and all that kind of thing. But I would say only the converted took action. Do you know what I mean? Same with climate change. Only the really passionate people have already gone for an electric vehicle or are already walking instead of driving and that kind of thing. It's not until you put that legislative framework, like banning smoking in certain places, banning plastic bags in supermarkets, that the majority will come along for the ride. And so whilst we can all only do what we can do, I feel like EHOs can't do this on our own. We need governments at all levels and industries to be aligned on that journey, just as we do with climate change. And it doesn't matter whether you look at it collectively for all of the SDGs, because they're so interconnected when you drill down into them, or whether you isolate climate, water, waste, food, disease, poverty, all the thing. It doesn't matter which way you look at it. There's only going to ever be so many people that do the right thing just because it's their nature, as opposed to the structures that we have in society that create those frameworks for at the risk of sounding like a dictator. I don't mean it like that, but I just mean, we live in a very, very populated, densely populated world now, and we need those systems and processes to have an orderly way in which we do things in society. So yeah, I feel like I actually had thought about planning, Julie. I was thinking that as well, because once something's built, it's very, very hard to change it. You know, we've seen that. We see all the cities that are built on floodplains. Then we have these big floods and everyone says, oh, they shouldn't have been built on a floodplain. But when you've got an entire city and all of its industry and everything already located there, it's very hard to undo that. We need to have, you know, the SDGs and as well as natural resources and manufactured resources all embedded into a framework that puts, as you said, Julie, sustainability at the core of it all. We need that to happen. And then as EHOs, our role gives us access to a wide range of people and stakeholders to be advocates, to be educators, to uphold, promote and encourage people to not just do the bare minimum that they're required to do under the legislation, but do everything we can, you know, for our health, for our planet. So yeah, that I really think that's where it's going to come to. We've been talking about climate change for a very long time. Oh, look, you know, the world's getting hotter, the icebergs are melting, you know, we could see the effects coming. And I'd say it's only really in the last year that it's been more collectively agreed that it's now an imminent crisis, that there is no more delay that we can have. And I feel like that same sort of thing's going to happen with the SDGs as well. We're fast approaching 2030 and we're nowhere near leaving no one behind. Do you know what I mean? So it's, yeah, I feel as though like actually now the universities are in Australia certainly are including education on the SDGs across all of their faculties. So the new generation coming through, the new graduates certainly know what the SDGs are and have a bit of an ignited passion for them. I can hear that coming through, but then they're going into workplaces where the established professionals aren't on the same page and the frameworks in the standard operating procedures and the way they do their work don't embed the SDGs. So we need those things to match up. We need to have these new graduates and the new professionals coming through to be able to continue on with what they're learning at uni and apply that in the real world. And that's where we need all the ducks to line up for that to happen. So,
yeah, I think you hit the nail on the head there in terms of the established environmental health officers, and it's not absolutely everyone, but I think we'd be safe to say that more often than not there is a majority there. They don't really know them, they don't really live and breathe them, as opposed to some of the fresh blood coming in that are now hearing about it through their graduate studies. I think that's a really fair call, and it's certainly the case here in New Zealand. I can tell you that. Magat, what are your thoughts there in terms of preserving some of our resources? What can environmental health officers do?
Yeah, I believe the most important things to promote the preservation of these resources is via the promotions of responsible consumptions of resources and the productions of goods and services. While the environmental health practitioners have always been dedicated to ensuring the public has access to clean water and sanitation, as well as access to safe food sources, more effort needs to be made on the prevention side. In this, we need both the support of the public and the government, especially in terms of manpower and resources, and to ensure that industries comply with the environmental standards, and that more responsible consumptions of resources and productions of services. Goods and waste are being practiced. Not only that, perhaps the partnerships and the collaborations need to be fostered within the governmental agencies, among the industries as well as the public, because otherwise the environmental health practitioners alone will not be able to make much of difference. Collaborations and is key, I think, to ensure that our resources are protected And this pandemic has shown us how interconnected we are, be in terms of our relationships to one another, but also within the various environmental factors. So if one falls, the other will follow. Therefore, the protections of environmental resources will need full support and more targeted and focused collaboration between and within agencies. Environmental health practitioners will have a very specific role to play in these issues, but so do other people and other agencies.
Yeah, absolutely right. In terms of that cross-agency and collaborative approach, I think even as Dave said before, and I wish you'd tell a few more people in New Zealand this one, Dave, that public health is a part of environmental health and not the other way around. But that's an example in itself that we shouldn't be working in silos in different directions. We are actually all in this together. You know, and I think we all know in different walks of life what working in silos does and doesn't achieve, and more often than not, it doesn't achieve a lot, or nowhere near as much as it could. I guess in the interest of just wrapping up, we'll just move around the room one last time in terms of the virtual room, that is. Where are we with environmental health in terms of how can we improve awareness of our profession overall? And that might include any barriers that you think are currently there for your part of the world. And if there's any final comments you'd like to add in just in relation to the theme for World Environmental Health Day this year. So Kelly, we might start with you from Australia's perspective. What are your thoughts?
It's an interesting question. I still would say the majority of the time when someone asks what I do and I say I'm an environmental health officer, they say, what's that? And if you say, oh, you know, a health inspector, they go, oh, okay. You know, that term, I suppose, is an old one that most people still understand what that is. In terms of promoting our profession, I think, unfortunately, because we do regulatory work, because we issue licenses and permits with conditions and we investigate breaches of regulations and legislation, I suppose we can be seen as the bad guys, you know, oh, watch out, here they come, they're going to close our business down or give us a fine or stop us doing what we're doing. There'd be an element of that. I don't think many people, or certainly not the majority of people, know all the good stuff that we do. They don't know that we do research and that we do investigations with a positive intention of, you know, reducing adverse health impacts and protecting the environment. And so, yeah, I sort of feel like I don't know how the best way is to communicate that across. I'm saying that from my own experience. I would say that the general public probably just think we go and check food businesses and that's about it. You know, they don't see it necessarily as a field of science, you know, or certainly applied science. And so how do you reframe that? Certainly there would be a lot of people that didn't really know what epidemiologists did before COVID. And then suddenly you saw all these epidemiologists from the World Health Organization and from health departments across the world being on Twitter and Instagram and in the news because they were the ones giving the reports, and suddenly everyone knows what they do and thinks they're wonderful. Do you know what I mean? We didn't get that same bit of limelight, I guess, in the COVID time. Yeah, so look, I don't know, when will our moment in the sun come? We know what we do. We know it's very important what we do. We know that there'd be a lot of catastrophes in health and the environment if we didn't do what we did. But yeah, as for the public awareness of our profession, it's a tough one. I think a lot of the work that we do is, sorry, my dog is barking. A lot of the work that we do is silent and in the background, and it's preventative. And so they don't necessarily see the outcome of that. Yeah, tough one in terms of how to promote it. Yeah, really tough.
It's interesting you say, you know, you introduce yourself as an environmental health officer and people look at you and they have a question and they wonder if you hug trees or what do you do, and you say health inspector and they go, ding, I know what that is.
Yeah, because like I'm also an environmental scientist, and when I say that, nobody, you know, bats an eyelid. They know exactly what that means. Yeah, it's a funny one. I don't know why.
Yeah. Similar story here in New Zealand. Most people think we're just food safety and that's it. Our name change with our food legislation here probably hasn't helped that. Even within the last few years, we were inspectors, we were auditors, and now we're verifiers. But when you even say to a food business who should really know, you'll do a verification, they go, a what? We're coming to inspect you. Oh, okay, cool. Yep, I know what you mean. So, you know, language we use, I mean, there's sometimes, I'm not suggesting we have a title change or profession change, but that education, that awareness, it is a tough nut to crack, but I guess it's a drum we just got to keep banging as much as we can. Migat, what are your thoughts there in terms of promoting environmental health further, and how do we do that?
Well, this is in this digitized era. I guess we could try TikTok.
Oh, I don't do TikTok.
But
I don't even
on
do
a more serious note, promoting the awareness of the environmental health professions would require a two-pronged approach. One is where we promote the awareness of environmental health issues among the public. Is very, very important and crucial. And the other is the politicizations of current and future environmental health issues and professions. The first is important because while people understood that food safety and clean water and preventing infectious disease is important, not many realize that these are all interrelated within the field of environmental health. The second is that unless the profession is recognized with the governmental agencies and our leaders, we will be relegated to the backbenches of the healthcare system in Malaysia. We are important, in fact, even more so that another healthcare professionals, as we are in the main barrier of preventing illnesses and disease spreading, all of which would put a burden on hospital and doctors and nurses. There are only so many hospitals we can build. So save life and cure illnesses, but it will be better to remind people that prevention is better than cure. And environmental health practitioners are critical in preventing and lowering the burden of disease among the public. And the lack of awareness of the interrelationship of the environmental factors and health, as well as the lack of awareness of the importance of preventions in the main barrier towards promoting environmental health professions. That's what I think. Thank you.
Yeah, well said. I think that's longer than the average TikTok. Not that I know much about TikTok, but that could work, Migat. We'll park that idea for another day. Julie, what are your thoughts about environmental health as a profession, and I guess how we might move it forward?
Yeah, it's interesting you asked the question, actually, because I did a series of posters a few years ago which showed the contribution that environmental health made to saving the NHS money, to saving business money, to saving the country nationally money. And I didn't put a title on them because I couldn't think of one. And we sent them to the designer and he put the title on and he used 3 words: environmental health, unseen, undervalued, essential. And I thought, well, that'll do for me. If this is someone who knows nothing about the profession and that's his view on what we are, that's about right. And I've tended to say to people who've asked me what environmental health is, it's about protecting the stuff that you just unconsciously accept. If you breathe clean air, if you eat safe food, if you drink safe water, an EHO has probably influenced that, but you don't even know it. And I think that's our problem. If things are going well, we are doing our job, but we're not seen. And what we need to do is put a value on what we do. How much did the pandemic cost? And how many of those have we not had because of what we've done? It's easy to say how much a disaster has cost, or how much a pandemic has cost, or how much a food poisoning outbreak costs. The difficult thing is to quantify how many of those we haven't had and say that's actually the value of environmental health. And we've wrangled with that for years. We really have wrestled with how we say what our profession is worth, what it delivers in pounds, shillings and pence, because that's really what matters to government. What does this industry save you? And we need to get our heads around that. We need to say, you know, we may be doing stuff that's regulation, but what it actually saves the country and individuals is X. And if we can do that, I think we promote the value of what we do.
Yeah, that's a really good point. I mean, dollars and cents, nothing gets a politician's attention quicker, right? So absolutely. Well, pounds and shillings, I guess, in your part of the world, but yeah. I like what you came up with there. Did I get that right? The 3 words, was it undermined, undervalued, essential?
Underseen, unseen,
Unseen, sorry.
undervalued, essential.
Yeah, I like that. It's I think those 3 words, whoever your designer was, I hope you paid him well for that. He's hit that on the head in 3 words exactly, I think. I also like what you're saying, you know, if we are doing our jobs properly, then, you know, we're in the background very much. And a wise man once told me, you know, we worry so you don't have to. And I'm going to throw to that wise man now, Dave. I'm stealing your words there, and I've used them ever since you told that to me a few years ago. What are your thoughts?
I never want to speak after Julie ever again. So
I remember that.
Yeah,
she had the mic drop moment there, and it's hard to follow.
Yeah. So my perspective is that as a profession, we spend a lot of time on the what, and I believe that we should spend more time on the who. And the who is on this video right now, and the who watching this webinar. To the people listening, you matter. We all matter. And who you are, your character, how you comport and deport yourself, how you interact with your constituents speaks volumes about the profession. And so while NEHA is proud to be people-centered and data-enabled, we start with people, we start with human beings. And one of the things, Tanya, that I know, riffing off of Julie, is every person, irrespective of their faith, of their sexual orientation, of the country that they live in, they have 3 common elements that kind of bind us all together. And that is, everybody cares about their health, everybody cares about their safety, and everybody cares about their and their family's financial security. And I keep that with me as I travel through the day, because I try to communicate the value of the profession, and it's profoundly important in my estimation, frankly, to the sustainability of the planet. I try to frame out my comments to our constituents that way. If you value your local economy, then you're going to want to work with us. If you value the health and safety of your communities, you're going to want to work with us. Think about the intimacy of this profession. And I use that word intimacy on purpose, because what is more intimate than the food you put in your baby's mouth, Tanya? What is more intimate than the water that you may recreate or bathe in? What is more intimate than the air that you inhale into your lungs? And I think those types of characteristics of our profession are often overlooked. We're the most intimate of the public health professions. How do we use that knowledge and empower our constituents to do the best they can in the local work environment? And as I close, I'd just like to say thank you. Thanks to everybody who's speaking today, and thanks to folks watching. What you do is important, and never forget that, particularly on World Environmental Health Day. Tanya, over to you.
Thanks, Dr. D. Yeah, there's a couple of things there from around the room. I think the dollars and cents, what would get government's attention to make, you know, even as you said, Kelly, the sustainable development goals, the framework and a lot of our legislation in each of our countries and around the world. If we can do that, if we can get politicians or the right people's attentions to make those kind of shifts happen, then really great things will start to change and occur. On a personal level, you're right, the intimacy, Dave. if we can get the end consumers, the people who at the end of the day are the people we're looking out for, the ones that we are worrying about so that they themselves don't have to worry about the food they put in their baby's mouth and the water that they drink and bathe in and the air that they breathe. How do we get across the value of all of these resources, these things, as they tie into the sustainable goals? Because sometimes if you tug on the heartstrings, if you make it personal, and if you can demonstrate the value, that's how you get the shift in the mindset. And you don't just have the early adopters, you have the majority following. Unfortunately, as we know, the two are related. So you may need to have the legislative changes to really push that along to make the majority of people do it. But if we can bridge the gap between how do we make it personal on one end of the scale and how do we make it political, I guess is the other way I'd phrase it. Maybe that's a way we can start to build this bridge, and environmental health might just be the building blocks that pave the road, who knows. I'd like to give a really big thank you to you all for giving up your time for joining me. As I say, this evening, which has now just rolled into the early hours of the morning here in New Zealand anyway. I've officially hit over midnight. But it's been a pleasure, and it's been great to catch up and hear the different perspectives from around the world, the different thoughts and theories. My hope is to anyone watching this as well that you've taken something out of it, you've come away with this with a little bit of inspiration and a little bit of knowledge about, I guess, tapping into where is environmental health sitting around the world. Sometimes we go to our 9-to-5 job, so to speak, and we walk out and we forget that we're part of a bigger picture here and a bigger environmental health family, and certainly a bigger part of things at play on a global level. And I think we all know what we're talking about there, not just the sustainable goals. So on this Environmental Health Day, again, we thank you for tuning in, and hopefully you can go away and just have a wee think about what you can do individually and what you can do to find your voice, which is something here in New Zealand we really value at our institute, as being the voice of environmental health for New Zealand. I encourage you all to be the voice for environmental health in any walk of life and every walk of life that you find the opportunity to do so. Once again, thank you again to all of our panelists for joining me. It's been a pleasure, and I hope we'll touch base again soon.